Good afternoon and welcome to today's webinar, COVID-19 State and Local Government Actions to Address Housing Insecurity, brought to you by the Network for Public Health Law. I'm Charles Strong, the Digital Marketing Coordinator at the Network's National Office, and I'll be your host for today's webinar. A quick note that both the presentation slides and video playback for this event will be available on our website shortly after the conclusion of today's webinar. We strongly encourage attendee participation and would love to hear from you, so feel free to submit your questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the drop-down menu, and send us your question. We'll be addressing them during the Q&A session during the second half of today's event. Your moderator for today's webinar is Carrie Lowry. Carrie is the Deputy Director and Director of Grants and Research at the Network for Public Health Law's Eastern Region Office, where she provides legal technical assistance on a variety of public health topics. Her current work focuses on empirical legal research and coding, injury prevention, and child and adolescent health policy. Carrie will be leading us through the rest of today's webinar, so Carrie, over to you.
Thank you, Charles. Thank you, everyone, for joining us this afternoon. On behalf of the Network for Public Health Law, we're just thrilled that you're joining us today. We have an amazing panel for you today to discuss housing issues in the face of COVID-19. Emily Benfer is a visiting associate clinical professor of law. She is the director of Health Justice Advocacy Clinic at the Columbia Law School, and she's a national expert on health justice strategies to secure health equity and social justice for low-income and traditionally marginalized communities. Professor Benfer was a visiting distinguished scholar and senior fellow at Yale Law School Solomon Center for Health Law and Policy. She was a clinical professor of law at Loyola University Chicago School of Law, where she founded and directed the Health Justice Project, a fully integrated medical legal partnership at Erie Family Health Centers, in which healthcare providers, lawyers, and law students resolve the social determinants of poor health for patients. Under her leadership, the Health Justice Project received the CLIA Award for Excellence in a Public Health Interest Case or Project and the Outstanding Medical Legal Partnership Award from the National Center for Medical Legal Partnership. Professor Benfer served as a teaching fellow and supervising attorney in the Federal Legislation and Administrative Clinic at Georgetown Law Center. She's received numerous commendations for her commitment to health equity and social justice, including the American Public Health Association's David P. Wall Award for Advocacy. In addition, she was named a Legal Freedom Fighter in Chicago Magazine Chicagoan of the Year. Professor Benfer has testified before Congress and appeared in numerous media outlets. As director of the Network's Eastern Region Office, Kathy Hoke draws on her many years of experience as director of the Legal Resource Center for Public Health Policy at the University of Maryland Carey School of Law. This is a position that she continues to hold. Since 2002, Kathy has directed the center, working with state and local health officials and legislators on developing and implementing tobacco control, problem gambling, and injury prevention policies. Kathy's work in injury prevention has focused on Maryland state and local policies, including legislation requiring all vehicle occupants to wear a seatbelt, encouraging the state's Medicaid program to cover special needs car seats for medically fragile children, and pedestrian safety. With the network, Kathy covers myriad issues, including injury prevention, environmental law, healthy and affordable housing, regulation of cannabis, food security, and immigration and public health. Kathy is widely published in peer-reviewed and legal journals. Her articles cover issues ranging from nursing scope of practice laws to novel approaches to securing access to Hep C treatment. So without further ado, I will turn the controls over to our first speaker, Emily Benfer. Emily?
I want to focus on the factors that make individuals more vulnerable to getting severely ill or dying from COVID-19, including people who are elderly and people with certain underlying health conditions. That kind of vulnerability is vitally important in this crisis, but so are the factors that make someone more vulnerable to secondary health harms that result from our response to the crisis. Social distancing and sheltering in place have emerged as key strategies for flattening the curve of the epidemic and mitigating impacts on already stressed healthcare systems. For the strategy to work and to reduce the long-term harm, federal, state, and local leaders must take immediate steps to support people's ability to comply with shelter-in-place orders and recommendations. This means added housing security, especially for people facing job loss, homelessness, and eviction. This is especially true for people living in low-income communities, people who lack access to affordable, safe, and healthy housing, and traditionally marginalized populations who have historically faced increased risk of neglect or mistreatment by government authorities during times of emergency, like pandemics and natural disasters. Low-income populations are among the most vulnerable to COVID-19 contraction and complications because of the effect of poverty on health and the ability to shelter in place. According to the most recent data from the Census Bureau, 38.1 million people, or 11.8% of the U.S. population, were living in poverty in 2018. The lower a person's socioeconomic status, the more limited their resources and ability to access essential goods and services, and the greater their chance of suffering from chronic disease, including conditions like heart disease, lung disease, and diabetes that may increase the risk of COVID-19 mortality. In fact, low-income adults are 5 times as likely to be in poor or fair health as those with incomes 400% of the federal poverty level. At the same time, race strongly influences socioeconomic factors, and Black Americans continue to have both lower incomes and shorter life expectancies than white Americans do. When disparities in underlying health conditions are compounded by a pandemic, these populations become especially vulnerable to adverse health outcomes. Essentially, they are the hardest hit. The pandemic is increasing economic instability across the country. According to the U.S. Bureau of Labor Statistics, 10 million Americans filed for unemployment in March. Experts estimate that the unemployment rate was between 10 to 15% in March. For comparison, the unemployment rate was 3.5% in February, and after the 2008 recession, the unemployment rate peaked at 10.2% in October of 2009. 27% of Americans have had to take a pay cut. 20% of Americans have lost jobs. And according to the Pew Charitable Trust, this economic impact is having a disproportionate effect on communities of color. For example, 40% of Latinos took a pay cut and 29% have lost their jobs. Nearly 50,000 outpatient jobs were lost in the healthcare industry in March. As companies are forced to initiate widespread layoffs, and especially if there is a prolonged recession, federal, state, and local governments will need to engage in forward-looking planning to alleviate the severe and long-lasting burden on low-income and marginalized communities. Before the pandemic, an average of 300,000 people faced eviction in a typical month, and over 2.8 million were on the verge of eviction. 1 out of 5 people pay over half of their income to housing, and less than half of these households will have more than $10 in savings. Eviction is bad for health. People who are threatened with eviction even before they lose their home are more likely to report poor health, high blood pressure, depression, anxiety, and psychological distress. Eviction often leads to residential instability, moving into poor quality housing, overcrowding, and homelessness, all of which are associated with negative health effects among adults and children. This map, created by the Eviction Lab, describes eviction filing rates based on 2016 data. As indicated by the red circles, eviction filing rates were as high as 7.5%, and the shading from light to dark purple denotes the very large renter population across the United States. Even before the pandemic, low-income and traditionally marginalized populations were already forced to choose between paying the rent and for other necessities. Today, that choice is literally a matter of life and death. These effects are exacerbated for people of color who are subjected to the consequences of discrimination and segregation in housing, on top of housing shortages. To end the pandemic, it is critical that renters be protected from eviction, and as Kathy will describe, that people experiencing homelessness and domestic violence be provided safe shelter. Otherwise, they cannot comply with orders to safely shelter in place. Fortunately, many state and local courts and governments are recognizing that housing is health, and this is especially true during a pandemic when the prescription is to shelter in place. These states are forestalling evictions to various levels of protectiveness, and many of the statewide emergency declarations, like this one from New Jersey, note that housing security and stability are critical to public health and that eviction, foreclosure, and homelessness increase the risk of COVID-19 infection and mortality. In fact, of the states with the strongest eviction moratoria, over 60% of the eviction freeze declarations noted the relationship between housing and health and the pandemic's effect on rent hardship. While the number of states with eviction moratoriums are growing, the moratoriums are not uniform, and they do not suspend all stages of the eviction process. Generally, eviction is broken down into 5 stages, including notice of eviction to the tenant, filing of the eviction claim with the court, a hearing on eviction where evidence is considered, an order of eviction, and finally, enforcement of the order of eviction by the sheriff. Not one state or territory in the United States has frozen every stage of eviction. In fact, 15% of states have suspended notice of eviction, 20.3% of states and territories have frozen filing of eviction, 30.5% have frozen hearings on eviction, 32% have stayed orders of eviction, and 37.3% have halted enforcement of new evictions. Notably, the Massachusetts State House of Representatives just passed model legislation that would forestall all 5 stages of eviction, but the state Senate would have to adopt it in order for it to become law. Across the country, the moratoria for eviction lack uniformity, and they vary in their level of protectiveness. The state approaches can generally be grouped into these 7 categories and are the combination of emergency legislation, gubernatorial declarations, and court orders. 21 states and territories have suspended both eviction cases and the execution of orders of eviction. 1 state has suspended civil cases, which should include eviction, as well as orders of eviction. 12 states and territories suspend eviction cases, and 8 states suspend civil cases, but do not freeze the execution of orders of eviction, leaving it to local government and sheriffs, who could face a misdemeanor for failing to evict a household when ordered. 2 states and territories have suspended enforcement of eviction only, and in 4 states and territories, the only moratoria requires that tenants prove non-payment of rent is due to COVID-19 hardship. This approach places a heavy burden on tenants who may not be able to contact employers or medical providers in order to obtain proof. And this approach also only delays eviction. It also raises questions about protected health information and privacy. 7 states and territories leave the decision to local discretion, and 4 territories have no order in place. Some states have also explicitly halted commercial evictions, foreclosures, and utility shutoff. %80 of states still allow online filing, and others have approved remote hearings, though it's unclear if they are doing so in eviction cases. The majority of courts use declarations instead of notarized affidavits in criminal and civil cases. And many states are limiting the moratorium to non-payment of rent eviction cases. And where the cases are suspended, courts are still remaining open for emergencies, including eviction due to criminal activity, protective orders, lockouts, and life-threatening conditions in the home. The majority of emergency stay-at-home declarations exempt individuals who are experiencing homelessness and strongly encourage them to seek shelter. And victims of violence are also permitted and urged to seek safe shelter. However, not every state has created additional shelter or housing for these populations. You can learn exactly what is being suspended in your state, district, and county on local and government court websites. And in addition, the spreadsheet that is linked in the slide includes national information that is being updated daily. Although it fell short of creating a nationwide moratorium on eviction, the Federal CARES Act filled in some of the gaps at the state level by creating an eviction moratorium in federally assisted housing and in homes with federally backed mortgages across the country. The CARES Act eviction moratorium went into effect on March 27th and covers these programs: VAWA covered housing, the Rural Housing Voucher Program, homes with federally backed mortgage loans applying to 1 to 4 units, and federally backed mortgage loans for multifamily housing, which has more than 5 units. To give you a sense of scale of this eviction moratorium, VAWA covered housing programs include 15 housing programs. The HUD-administered program alone covers 10.4 million people in 5.2 million households. But what does it do? For covered properties, the CARES Act bars the filing of any eviction case for non-payment of rent for 120 days, which is around July 25th, and requires 30 days notice thereafter. In addition, there is a 6-month foreclosure forbearance. The National Housing Law Project advises that because the scope of covered properties is extremely large, advocates should assert that the tenant is protected by the moratorium and that the landlord who files an eviction suit for non-payment must prove that the property is not subjected to a federally backed mortgage loan or housing program. However, like the U.S. states and territories, the CARES Act did not include a payment plan requirement for tenants who are behind in rent, and it also did not provide rent relief or debt forgiveness. It failed to address the substandard conditions that are common in federally assisted and private market housing in low-income communities. Low-income people are likely to live in homes with poor air quality, mold, asbestos, lead, pest infestations, and inadequate space to separate the sick from the well. Tenants in rental housing are disproportionately suffering the negative health effects like asthma, respiratory distress, carbon monoxide poisoning, high blood pressure, heart disease, mental health impairment, among others, that result from environmental hazards in substandard housing. Asthma and heart disease in particular are exacerbated by poor housing conditions and increase the risk of severe illness and death from COVID-19. These conditions could pose health risks for many low-income individuals and families and increase the need for emergency care as well as the severity of COVID-19. So what are we to do? How can we actually protect people who are low-income and traditionally marginalized communities? Well, the following recommendations are only specific to eviction and housing and are not exhaustive by any means, but all recommendations should comply with a health justice approach. First, legal and policy responses must address the social determinants that threaten to exacerbate the health, financial, and social impacts of a public health emergency on low-income communities, communities of color, and other subordinated groups. Second, interventions mandating healthy behaviors, like social distancing and sheltering in place, must be accompanied by immediate legal, social, and financial protections and supports in order to facilitate those behaviors. And third, because emergencies typically exacerbate long-standing and interconnected crises in socially disadvantaged communities and economically disadvantaged communities, legal and policy responses must address the root problems in addition to these immediate urgent needs. So these next examples, they do not include broader yet critical recommendations related to healthy housing, fair housing, community development, and critical federal supports. If you are interested in these additional well-documented approaches, please feel free to contact me. And with regard to federal approaches, the National Low-Income Housing Coalition is leading a nationwide effort to address housing on a federal level. So what can we do immediately? First, recommendations regarding moratoria. We must adopt and extend eviction moratoria for at least 6 months after the emergency declarations end. Many of the state moratoria are set to expire the day that the public health emergency ends. Tenants who lose their jobs or whose hours were cut will need more time to obtain employment and earn rent money. At a minimum, these moratoria should match the 120-day federal moratorium. Utilities such as water, gas, electricity, phone service, and the internet should be provided as public goods. Protection must be put in place to prevent utility shutoffs for every household, regardless of the ability to pay. Utilities to be included are water, gas, electricity, landlines, internet, and this ban should last for at least 1 month after the emergency declarations end. At the same time, localities and utility companies should be mandated to restore utility service to all households, which has not yet happened across the country. Landlords should be required to waive or suspend fees for missed or late rental payments. Rent raises could increase the risk of eviction, so rent control ordinances should immediately be adopted. States and local governments should treat unpaid rent and mortgage payments like an unsecured debt that is unrelated to the tenancy in order to keep people behind in rent stably housed. And there must be a strict enforcement against landlords who are violating the moratoria. When these moratoria are lifted, we're going to have an avalanche of evictions. It's very important to take action now so that when society is coming back together and recovering, we can protect vulnerable populations and ensure that the property owners are not themselves becoming a vulnerable population. So first, we must provide a civil Gideon for tenants who are served an eviction notice in the year following the pandemic or during the pandemic. This will provide them with free legal services. We must permit out-of-state lawyers and supervise law students to provide pro bono services in other states so that we can ensure that everyone is covered. We can mandate payment plans or mediated settlement negotiations, and we can adopt community court models to divert tenants from eviction. We must seal eviction records nationally and expunge past records so that people are not discriminated against on the basis of having an eviction when they're looking for new housing. And we must bar retaliatory eviction and require clean hand evictions, which mean that the property owner must comply with all of their laws prior to issuing an eviction notice. But we have to pay for it. States and local municipalities should create emergency funds to shift housing-related financial burdens from landlords to the government. And this will require significant federal assistance. So first, we must create and expand emergency rental and mortgage assistance funds and make these funds available now. We must create and distribute housing subsidies. Housing subsidies would alleviate the burden of rent and mortgage payments among individuals whose finances are most severely impacted by the COVID-19 crisis. In the past, modest subsidies have been shown to be effective at keeping 80% of first-time homeless families at risk of high eviction out of homeless shelters and first-time homeless families housed for a minimum of 2 years. We should also cover any legal fees for low-income tenants throughout this process and provide case management and housing counseling services. Funding should also be included to study the outcome of all of these interventions. For example, 1 year would be enough time to demonstrate the cost-benefit of civil Gideon and affordable housing on housing stability and health outcomes. And we need to fund healthy homes interventions. It cannot be considered housing if it results in chronic morbidity and other health conditions. And we must invest in the rejuvenation of low-income communities and to assist property owners provide property tax relief. In addition to these measures, it will be imperative to develop and implement sound policies to preserve and develop affordable and healthy housing and to provide assistance to housing providers, including landlords. The COVID-19 pandemic surfaced the socioeconomic divide, health and race disparities, and the lack of safety net in America. But it is the response I am confident that we will all remember, especially if it represents our collective altruism and secures health equity and safe and decent housing for every member of our society. And with that, I'm going to pass it over to Kathy to discuss homelessness during the COVID-19 pandemic.
Thank you, Emily. I'm going to assume you can hear me unless I hear otherwise. Thank you both for your presentation and for the, I think, monumental work that you've been doing in collecting the information and advocating for policy to support folks with housing insecurity at this time. I'm going to speak to the homeless population and how this is impacting them. So first, just to set the stage for folks who may not, be as well versed here, there are on any given night approximately 600,000 Americans, people experiencing homelessness in our country. It's likely undermeasured, but that's the number that we traditionally use. The population has been aging, meaning older people are more a higher percentage of the population. It will come as no surprise that these are individuals who are more likely to have low access to health care and high need for health care because they suffer more likely from chronic medical conditions. And in fact, in this country, they may have been rendered homeless because of the high cost of accessing necessary medical treatment. They are less likely to receive nutritious food, to get an appropriate amount of sleep, and have access to sanitation for both hand washing, bathing, and toileting. So, that is the description of people vulnerable here with respect to COVID. But some specific data, they are 2 times more likely to be hospitalized if they contract the virus, 2 to 4 times more likely to need critical care, and 2 to 3 times more likely to die. So there's obviously a lot of reason to want to focus on this population and getting resources out quickly. I first want to talk about, in some respects, the federal response or the financial response. So the CARES Act, which was that third COVID bill passed by Congress, does contain one significant provision that is explicitly designed to get at the addressing issues for the homeless population. It pumps $4 billion into an existing HUD program called the Emergency Solutions Grants Program. That program assists individuals and families. The goal is to quickly regain stability in permanent housing after experiencing a housing crisis or homelessness. What the Act has done, in addition to popping $4 billion into that will trickle down to the states, is eliminate some of the bureaucracy. As you can see on your screen, probably most important from a population perspective is people experiencing homelessness cannot be required to seek treatment or undertake any other counseling type of activities in order to receive shelter. So to use these dollars, the states have to commit that. There's also great flexibility for HUD in the Act to modify other, again, bureaucratic elements of the ESG program as necessary to meet the changing needs of the homeless population in the COVID crisis. 2 other areas in the stimulus bill that I'll just quickly mention: community block grants of $5 billion will be distributed to state and local governments, and embedded in there is that they may be used to help keep safe people experiencing homelessness, as well as to prevent homelessness. And then the big chunk, $150 billion distributed to state and local governments through the Coronavirus Relief Fund, very broad, available for very broad public health purposes. And so obviously providing shelter and care for people experiencing homelessness would fall under that block as well. I just want to review quickly how the state, so people are saying, if there's a stay-at-home order or a shelter-in-place order, how can that apply to people experiencing homelessness when they may not have a home or shelter? And so I quickly reviewed through the state's executive orders at some period in time. There actually have been some since, but there seem to be 4 approaches, plus some particularized language we see in Virginia at the bottom. Some are silent. The executive orders don't speak to applicability to the homeless population. Some specifically exempt people experiencing homelessness, and then a larger chunk of them exempt people experiencing homelessness and almost seemingly sarcastically urging them to find shelter. More importantly, there are a large number of states that exempt people experiencing homelessness, do urge them to find shelter, but also urge governmental and other organizations to assist in providing shelter to people experiencing homelessness, and specifically mentioning that shelter should abide by CDC guidelines for the COVID era. You can see the Virginia language that I placed on the screen, largely because it speaks to obligation on the government that relevant state agencies shall continue to work with their housing partners. I'm not saying Virginia's doing it perfectly, but sometimes language does make a difference. And here, they're not speaking to the obligation of the person experiencing homelessness, but rather the obligation of the state as well as the housing partners who are probably doing more work than anyone thought possible. So what are some of the best practices with respect to the ways that homeless individuals may be sheltered or be living? First, we look at and I say good practices instead of best, because the best practice would not to be having people in shelters where there are many people housed in an open space. But to be frank, we're not going to see elimination of those shelters at this time. So there will be continued use of shelters. There was a comment in one of the questions asked in advance about where people will go when the shelters close. Every executive order allows for and encourages for the continued operation of homeless shelters. So hopefully closures have been experienced for temporary reasons to disinfect and sanitize, but the shelter should be up and running. So the best practices for shelters would be providing separate living spaces, and I don't mean separate rooms because we know that's not possible, but really mapping out the space where individuals will be sleeping in ways that provide at least the 6-foot distance when they are sleeping, not using common areas for food service or other kind of communal distribution that used to be the practice. So these shelters are particularly appropriate for well or low risk persons, as long as those CDC recommendations for modifications are met. Best practices do include screening individuals before entry, and the CDC has released a screening tool to be used for this purpose. This will allow the shelter to determine whether this is someone to take in here or whether this is someone to take in perhaps at another location that might be providing care to someone with a higher risk or someone who has had exposure or symptoms of COVID-19. I'll speak to those locations in a moment. So then recommendations for obviously cleaning and disinfecting at the highest level possible. There was also a question in the advanced questions about anything addressing shared ventilation, and the answer there is no. I have not seen any regulation or anything with respect to regulating the shared ventilation systems, which is again why these spaces are not optimal, but just good. Establishing an isolation area for people who are potentially COVID-19 exposed or symptomatic for COVID-19, so that there is a clear separation between those individuals and the well individuals. As you can see, there are challenges to the shelters which make them less than optimal. In addition to kind of the communal eating areas and shared bathrooms, we know that meeting the CDC guidelines is going to mean fewer people can stay in any particular shelter, so it'll reduce the number of people served. And because of the communal nature of a shelter, if COVID-19 is experienced by a resident or staff member, they may have to close for a temporary period to undergo cleaning before reopening and perhaps staying closed for some period of time. That did happen to the Catholic Charities shelter in Las Vegas. You saw partly the result of that in setting up sleeping areas on parking lots in Las Vegas. Certainly less than optimal. The other area, so shelter diversion is the other area where we'll talk about best practices. This is clearly, a better practice, and that is identifying single occupancy residents or SORs for individuals experiencing homelessness. It doesn't necessarily have to be one person. It could be a family. We do know that families comprise a significant portion of the homeless population. This is looking at securing hotel or motel space, RVs, and increasingly now gaining access in areas where they have the space to FEMA trailers, where individuals can be housed in that separate occupancy, much more able to effectuate what looks like shelter in place or stay at home if you have these individual areas. The second prong is really seeking improvements to gaining access to permanent housing. So folks who are both on the waiting list or who apply for permanent housing to work through, again, breaking down some of the bureaucratic barriers to getting people access to permanent housing that would meet that definition of single or family occupancy residence. These areas, the separated areas, are priorities for those who are symptomatic but not in need of hospital care, those who have returned from potentially having been in the hospital, so for respite care, for people with underlying health conditions, as well as for families. And you can see that I added my own element there. For any human, this is a far more optimal, and they should be priorities as well. There has been a lot of challenges, however, to accomplishing moving the homeless population into empty hotels and motel space and FEMA trailers. With respect to the hotel and motel space in particular, it is extraordinarily expensive. Governor Newsom in California designated $50 million for SORs as what he calls Project Room Key. It won't be enough money. You see throughout Connecticut, they announced over the weekend that they believe they have secured enough hotel and motel space, at least for now, to single occupancy most of their homeless population, but it is coming at extraordinary expense. The federal dollars will help, but the $4 billion is about 1/3 of what is believed to be needed to actually house people experiencing homelessness in an appropriate way. I do want to also mention the NIMBY nature of this because it also arose recently in Orange County, California, where 2 hotels were being resourced to house homeless individuals who were experiencing COVID-19, and a community across the street was vehemently opposed to the siting of individuals there in fear for themselves. It was a retirement community of older people, and they were fearful of going to the grocery store or otherwise encountering individuals who were COVID-19 positive. So we do have community response that can create a problem. To just move forward, the next area where we might see homeless individuals living would be in encampments. I think a big victory came for advocates for homeless individuals when the CDC announced that a governing principle of not clearing encampments. As you know, this is a chronic problem for homeless individuals, having encampments cleared, their materials confiscated, et cetera. But during this time, the CDC has been pretty clear about expressing that there should not be clearing of the encampments. What's most important is that both law enforcement as well as people experiencing homelessness are aware that that is a best practice. There still are best practices within keeping the encampments open, encouraging the keeping of their tents or the areas where they're occupying with a 12-foot by 12-foot area per individual, as well as the community providing access to portable hand washing stations and toilets for obvious reasons. Just one example, there are many. The city of Los Angeles did vote to stay enforcement of a law prohibiting tents between 6 a.m. and 9 p.m. in certain areas of the city. So the tents are allowed to be up 24/7 in those areas, and they will be providing the hand washing stations, toilets, as well as dumpsters for individuals in those areas. So from a legal perspective, even if the CDC recommends that areas not be cleared, it really would be best if jurisdictions issued a stay of any provisions that are prohibiting individuals from staying in place in this situation. And so what do some of those laws look like, what we call anti-homeless laws, that probably should be stayed during this period from a public health perspective? And they're really those that either prohibit the possession of certain items in certain areas, so tents or chairs or the like in certain areas, or prohibit certain activities, sitting, sleeping, or panhandling in public places. So best practices would be to stay and issue a specific stay of enforcement of those provisions. Frankly, the really best practice would be to repeal these laws because they are ineffective at reducing homelessness. And they increase the interaction between homeless individuals and the criminal justice system in ways that don't result in improvements to public safety. Often in some communities, it results in homeless individuals bouncing from one area to another area because they get removed from one area and they just go to another area. and confiscation of their property certainly harms people experiencing homelessness. Often, whether it's their blankets or their clothing or medication that is confiscated during the sweep or during an arrest for them for violating one of these laws, ultimately does not benefit the homeless population. So not just the CDC practice, but actually issuing stays that these laws, if not repeal of their provisions, would be critical to supporting the people experiencing homelessness during this time. Just a couple of related issues I wanted to mention because we don't have time for more, but public education for people experiencing homelessness is critically important. We know that the messaging isn't permeating throughout the community, and we need to find better ways to do that so that they can understand what the symptoms of COVID-19 are, what they should do if they're experiencing those symptoms, how to best avoid exposure to the virus, where there is shelter available to them, any of the changes in law enforcement with respect to the setting up of encampments or repeal of anti-homelessness laws. Looking specifically at children experiencing homelessness, many of us will be shaking our heads to this. It's hard enough in the privileged area in which I'm living for me to homeschool my children during this time, but imagine in the homeless context. And so that's a special area for us to take into consideration, providing access to Wi-Fi, print resources, if we can't provide a device or a Wi-Fi for children. We don't want the education gap to get bigger, and that will happen if we don't take that into consideration. Also, considerations for individuals who are experiencing or who have substance use disorder, including alcohol and tobacco, and whether shelter rules or other rules for housing for homeless individuals can be adapted, because we know that there are individuals who do not seek access to housing because they're not permitted to engage in certain activities if they are in that housing. Right now, it's best to bring people into shelter, and so looking at ways to modify any of those restrictions so that we can get folks into shelter. And finally, as in any other emergency, some folks don't want to seek shelter if they can't bring their pets. And so communities thinking about how, from a community perspective, they can respond to support individuals and helping care for their pets if they are having to live in a space where they can't take their pets with them. Just a page of resources that I wanted to add here as well, because I was only able to take a small dent into what is out there. You can see the resources that are out on here. One of the comments or questions that came in before the webinar related to where we're going to be talking with any actual people experiencing homelessness or shelter providers. That's not really what we do here at the network, but there are two series of webinars, one by the National Alliance to End Homelessness and another by the National Low Income Housing Coalition, that I think are far more on the ground oriented, really providing access to technical assistance and resources for folks on the ground in the homeless community. And so I would recommend those webinar series as well as these resources. And then finally, just a reminder that imagine that if we were in this pandemic, but we were not having to address the resource-intensive issues associated with protecting people experiencing homelessness, because we have eliminated or seriously reduced the existence of people experiencing homelessness in our communities. Allowing homelessness to persist is a public health problem that grows exponentially in a pandemic. Eliminating homelessness is not only humane, it's not only good for public health, it is an issue of national security. Pandemics reveal the soft underbelly of our country. It is a weakness that drags us down in good times and in bad times. Our country will be healthier and stronger, more resilient to disease, economic downturn, or biological attack if we eliminate homelessness. And so on that, I'm opening things back to Carrie to moderate the Q&A.
Thank you, Kathy, and thank you, Emily, for two great presentations, incredibly important information for all of us. We received several great questions both before and during this webinar. We do have a little more than 15 minutes for Q&A, but I did want to say at the top, if we don't get to your question and it wasn't addressed during the webinar, and specifically I'm referring to the questions that were submitted before the webinar began, please do submit your question as a TA request through the network's website, www.network4phl.org. and someone from the network will get right back to you with a response. So first question, Emily, I'm going to start with you. The first question that came in through the chat was, do you have a percentage of the states, territories, and commonwealths that aren't addressing evictions? You know, it's kind of a tough question, but I know that you've been tracking these policies. Do you have a sense of what the percentage of jurisdictions are that are not addressing this issue?
There we go.
We can't hear you. Oh, there you go. Okay.
Sorry about that. So, you know, I think the question is nuanced. You know, if the question is which percentage of states is protecting low-income communities and all renters from eviction and enforcement of eviction that happened prior to the pandemic and the emergency response, it's almost zero. That the level of protection that is truly required in order to protect public health needs to be much higher than what we're currently seeing. The slide that broke down the different approaches to eviction into those 7 categories, of those, the most protective are really states that both freeze evictions from being filed and freeze evictions that are being enforced by the sheriff. So not allowing either of those to happen, including evictions that were filed and ordered prior to the pandemic or any emergency orders or emergency declarations. And there's only around 20 or so that fall into that category. There are just over 40 states and territories out of 59 that have, in effect, frozen evictions because of their approach to civil cases generally. But that in most of those states, people are still being evicted because of past orders. Evictions are still being filed. So the moment that these moratoria are lifted, we will have this avalanche of cases. You can see all of the evictions at the website that was listed in one of the earlier slides, and we'll make that available when we send out the slides as well.
Okay, great. Just a follow-up question too about eviction moratoria. There were a few questions that came in relating to protections that will exist past the expiration of the state of emergency. So, we know it depends on state and local law, but what concerns should states have that extend protections past the expiration of emergency? How do we address the issue tenants will be able to pay rent that has piled up even 6 months after emergency declaration ends, and that assumes that the individual will have their job back that pays enough, when the checks are restored. Do you have any thoughts on that, Emily?
Yeah, so that's a great question. So it is, as the question states, the risk of people not having regained employment at the end of the pandemic is very high, that it will take a series of months to years to really get everyone stabilized again. And the worst thing that could happen is during post-pandemic recovery, we have a dramatic increase in people who are unstably housed, who are doubled up, or who are homeless. And so to protect them from that outcome, to protect states from having to bear the brunt of the health costs, the security costs, and all of the other social issues that come with that, it's important to extend the moratorium, ideally to 6 months after the pandemic ends. But at the same time, critical to provide support to property owners during that time and to really build up the safety net of support in the rapid reentry, in housing subsidies, in rent and debt forgiveness programs. And so that's where the federal government funding is needed, and the diversion of funding in the state to those programs is critical.
Kathy, a question for you. Can the CARES Act money be accessed by cities to pay for utility bills for residents of the city affected by COVID-19 related unemployment?
So, Carrie, we were just breaking up in the beginning. Can you hear me okay?
I can hear you. There's some weird wind tunnel effect happening from someone.
So was it just, were you asking about whether the funds that I referenced could be used to help pay utility bills?
Correct.
So yes, the funds that I spoke to are both for individuals who are homeless as well as individuals who are at risk of homelessness. And so those may be individuals in the situations that Emily was speaking to where they are at risk of eviction, for non-payment of rent. The same applies for utilities. There have been, jurisdictions that have passed provisions not allowing utilities to be turned off during this time, but those funds could be used for any supportive services that will allow someone who is at risk of homelessness to remain in their home.
Okay,
that
great.
will be decided by the state or local jurisdiction that gets the money.
Sure. So a follow-up question for you, Kathy, and this is related to the Veterans Administration. What do you see as an appropriate and already authorized role for the Veterans Administration in addressing needs of current or expectable homelessness among veterans right now? And then there was a related follow-up question from someone else. Preemption by state or local jurisdictions enacting anti-homelessness policies. Any thoughts on that?
So I'll take them in reverse order. Preemption is a profound problem in public health, not just in the homeless space, but across public health. And so we do know that there are jurisdictions that have established either state laws that preempt locals from taking aggressive actions against homeless individuals, and there may also be state laws that prohibit local jurisdictions from, or that provide anti-homelessness provisions and don't allow local jurisdictions to exempt themselves from that. So nothing unique about that issue with respect to preemption, but I do think that it is typically an issue that is addressed at the local level. So very few states are operating on a preemption basis here. So there can and should be pretty plenary power at the local level to both pass these ordinances, repeal these ordinances, or stay these ordinances during this period of time. As far as the VA is concerned, it's an interesting question. I haven't actually looked at what the VA is actually doing in this particular time, or what the CARES Act may have provided to the VA with respect to housing, veterans. So my only comment can be, I'm not aware that the VA is doing anything other than the poor job that they've been doing with respect to providing shelter and medical care for individuals experiencing homelessness who are veterans. But I can do some follow-up on that if the individual wants to get in touch with me directly.
Great,
one thing to add to the emergency solutions grants out of the CARE Act related to homeless shelters, the bill language does allow for funding to be used for temporary emergency shelters and waiving federal habitability and environmental review standards. One thing that's especially important to note, none of the funds provided may be used to require people experiencing homelessness receive treatment or perform any other prerequisite activities as a condition of receiving shelter, housing, or any other services.
So this question is really for both of you. We have a lot of questions here related to specific vulnerable populations, such as the undocumented and homeless teens, for example, who are blocked from adult shelters. Do you have any thoughts on policies that may or may not pertain to undocumented immigrants, whether they have access to financial assistance and the like? And this question about your thoughts on homeless teens who are blocked from adult shelters and other programs due to their age.
So as far as the homeless teens, so again, we're living in an era where a pandemic has swept over and just revealed existing inadequacies in our system for dealing with people experiencing homelessness. And so we know that there are inadequate housing options for teens experiencing homelessness. And while any of the funds can be used to address any particular population, there is nothing specific in any of the funding mechanisms, nor have I seen any policies or changes to sheltering practices that would specifically address this problem. However, I'm not on the ground. That's where folks like the National Alliance to End Homelessness, Low Income Housing Coalition, they may have better ideas about what's going on the ground. Sometimes we don't see that in policy change. There won't be law change, but there will be adaptations on the ground for, how to accommodate individuals, maybe having a separate living space for those who are underage in a shelter where they may not have otherwise been able to house them. So I suspect that may be going on in real time, but I don't know that from a policy perspective. Emily, I don't know if you had any thoughts on, go ahead.
Yeah, with regard to undocumented and immigrant populations, I saw a few questions related to that population. The third stimulus bill actually cut out immigrants. So immigrants were cut out of provisions to ensure COVID-19 testing and care, as well as economic relief. And this obviously undermines our collective safety and economic future because COVID-19 does not discriminate, and our response shouldn't either. The National Immigrant Law Center has analyzed these bills and their effect on immigrant populations, as well as the importance of those populations to the front lines of our recovery from COVID-19, including immigrant medical and healthcare workers who are caring for patients who are suffering from the disease, which I think amounts to 1.7 million people. So I would definitely take a look at the National Immigrant Law Center's policy brief on what must be included in the fourth stimulus bill.
Great. We actually received a couple of questions, actually three, related to special provisions for unaccompanied, which we've just addressed, but specifically for domestic violence victims and their families. I think I know the answer to this, but are there any provisions being made for domestic violence victims?
So specifically in the provisions related to the funding, when we talk about people experiencing homelessness or people who are at risk of homelessness, there is specific direction that these resources should be made available to individuals who are victims of domestic violence and in need of shelter. So to the extent that any of these resources being made available, there's no limitation on them being made available, and in fact, they are explicitly designed to be made available to address individuals seeking shelter now. So you don't have to have been homeless before in order to access these services, and you don't have to, come in and say, no, there's no place I could go. There's a place I could go where I'm going to be, assaulted on a regular, basis. That is not a justification for turning you away from services or not allowing you to access the shelter that's provided for.
And to add to this question about domestic partner violence, and I think the reason this question was asked is because we know that sheltering in place can increase the need for emergency services, and that close quarters and economic distress can heighten the risk of domestic partner violence. And so this is something that we need to really address, and I think local governments can address this in their communities as well, because despite the Obama administration's call on local governments to repeal them, over 2,000 municipalities in the United States have chronic nuisance ordinances and impose penalties for repeated calls to 911. So during this pandemic, the immediate step is to repeal all of these ordinances for the long term, but also put a freeze on them right now because they put victims of domestic violence at increased risk of eviction when they call for help. And so in light of that increased risk and need for emergency services, they should immediately be repealed, especially as they arise from emergency events. So one way that we can protect domestic violence victims right now, in addition to the supports that are put into place.
Okay, great. I think we have time for one more question. Emily, this one's kind of two-pronged, and I'll lob this one at you. Right now, we're hearing about rent moratoria, which will delay payments. Have you heard any talk about rent forgiveness? And on a related note, what protections are offered for landlords and homeless services?
This is really where the federal stimulus is so critical, that we have to provide funding to the property owners and to the homeless service providers so that they are able to continue allowing people to safely shelter in place without jeopardizing their own housing and their own income sources. To date, I have yet to see any states across the country include rent forgiveness or rent payment in their response to COVID-19 housing insecurity or instability and the eviction moratoria. However, it is definitely one of my recommendations and shared with, I believe, national organizations across the country and others, that we all understand and recognize that this debt will not be able to be paid without support over time, which is also one of the reasons, just to reiterate, how important it is to uncouple the past owed debt for rent from the actual tenancy and have that be something that is more of a civil debt as opposed to tied to eviction, just so that we can keep people housed for as long as possible and weather this storm.
Awesome. Well, it's perfect timing. Thank you both, Emily and Kathy, for a really wonderful and informative webinar. Thank you all for attending and for listening. Both the presentation slides and the video playback will be available on the network's website. There are also a host of resources related to COVID-19 on the network's website, which I would encourage you to check out if it be helpful for you. Again, if we did not get to your question, please do go to the network's website and submit it as a TA request, and we'll get back to you as soon as we possibly can. Everyone out there, stay healthy, and we appreciate your attention this afternoon.
Thank you, Carrie and Emily. And Charles.
Bye, everyone.
Bye.